Hey there fellow knowledge seekers, I'm Jimmy and welcome to my channel. I'm your guide into the captivating world of medicine where we demystify intricate concepts to relatable everyday analogies. In today's journey, we will unravel the secrets behind migraine, a disease that may cripple us mentally, physically, as well as emotionally. As someone who has personally battled against migraine, I'm excited to share some of the potential ways to mitigate those dreaded attacks. So let's get ready to unlock the secrets behind migraines and discover ways to regain control of our lives. We will begin understanding the underlying pathogenesis behind migraine, followed by triggers of migraine, and finally an acronym that summarizes drugs within the migraine class. The underlying pathogenesis of migraine is due to the release of neuropeptides from the trigeminal nerve to the cerebral vascular blood vessel, which causes vasodilation as well as triggering pain signals in the brain via the nociceptors. The major proponents of these neuropeptides include VIP, substance P, as well as CGRP. CGRP is a potent vasodilator which will cause the blood vessel to widen as well as promoting neurogenic inflammation. This stimulation of vasodilation can be perceived as a pulsating type of pain commonly associated with migraines. So on the left of our slide, we have a roadmap visualization of the pathogenesis of migraine. And then to the right, we have a 3D spatial pictorial of how the release of neuropeptide from the trigeminal nerve can transpire into the vasodilation of the cerebral blood vessels. So a combination of factors may trigger a migraine attack. These include a combination of environmental factors, the current medication that we're on, as well as the current disease states that we may have. Let us look at some examples from each of these different points. In regards to environmental related triggers, some of these examples may include weather changes. So as a result of barometric pressure, temperature, as well as humidity, these can all trigger a potential migraine. Next, we have bright or flickering lights, strong odors, and that's also one of the main reasons why many hospitals ask their staff members to not wear strong odors. Besides that, we have lack of sleep, as well as dealing with stressful environments. For medication causes, there are hormonal contraceptives, vasodilators, monoamine oxidase inhibitors, and finally, both SSRI and SRNI. Estrogen levels are found to have an impact in blood vessels as estrogens can potentially dilate the blood vessel. So as a result, patients who are using hormonal contraceptives are found to have a higher risk of developing migraines. Vasodilators, as the name implies, increases blood vessel dilation, and as a result may increase cerebral vascular blood vasodilation. Monoamine oxidase inhibitors, SSRIs, and SNRIs all have an effect in modulating levels of neurotransmitter. And as a result of the modulation of neurotransmitter, both changes in mood as well as blood pressure may be affected. The increase of blood pressure may also increase intracranial pressure. And to relieve the increase in intracranial pressure, the cerebral vascular blood vessel would have to compensate by causing vasodilation, which in turn may translate into a migraine attack. Example of these medications are shown to the right, such as selegiline, which is an MAOI, and fluoxetine, which is an SSRI. We can also apply the concept of compensatory vasodilation in disease-associated trigger migraines. Any disease that potentially causes a rise in blood pressure followed by compensatory cerebral vascular vasodilation may trigger migraines. So say for example, hormonal changes during the menstrual cycle can increase the chance of migraine due to the surge in estrogen, which potentially has a cause to increase vasodilation. This often occurs before ovulation when estrogen level peaks. In cases of hypertension or other cardiovascular disease that causes an elevated blood pressure, the cerebral vascular vessel may dilate as a compensatory response to the counter increase in pressure. Unfortunately, this dilation can lead to an increase in migraine occurrence as a result. In individuals experiencing depression or mood changes, we observe a similar pattern. During the short-term stress or stressful states, the body will release cortisol in response to mobilized sugar and increase blood pressure to cope with the stress. This indirect pathway can lead to an increase in blood pressure and can ultimately trigger the same physiological response which causes a migraine. Next, we will explore the different clinical manifestations within the different phase of migraine. There are a total of 4 different phases within migraine: the prodrome phase, the aura phase, the headache phase, as well as the post-drome phase. The prodrome phase usually lasts about 3 hours to several days, and in this phase, patients often experience difficulty in concentration, mood changes such as increase in irritability, depression, or euphoria. The next phase is known as the aura phase. However, not all patients will experience the aura phase. Personally, for me, when I did have migraine, I never experienced aura. So the aura phase may last anywhere from 5 minutes to 60 minutes. The aura is a neurological phenomenon that involves temporary disturbances in vision, sensation, or speech. So common symptoms include numb or tingling in the face or hands, flashing lights or blind spots, or even ringing in the ears, otherwise known as tinnitus. The next phase is the headache phase, and is what people associate migraines with. This is actually the most painful phase, since most of the symptoms appears more severe in this phase. So these symptoms include unilateral or pulsating pain, dizziness, and blurred vision, as well as nausea and vomiting. And this migraine headache phase would usually last about 4 to 72 hours. The last phase of the migraine is known as the post-drome phase. This is the phase when patients experiences a recovery from the migraine phase, but may still experience some lingering symptoms. These symptoms may last from 1 to 2 days, and patients may often experience symptoms of fatigue as well as decrease in concentration since they are recovering from the migraine phase. Before we dive into the pharmacological treatment options for migraine, there are both non-pharmacological treatment options as well as migraine preventive medication that may help with the patient. Let's first explore the non-pharmacological therapy. Non-pharmacological therapy in general is individual based. In essence, patients need to identify what are the potential triggers that may cause his or her migraine. This could be a combination of both stress factors, drugs, which the patient is currently taking, environmental triggers, as well as practicing regular sleeping habits to potentially decrease the frequency of migraine. Next, we will explore the options for migraine preventive therapy. The goal of therapy is to prevent cerebral vascular dilation through controlling blood pressure or by dampening pain signals, which decreases the intensity of migraine headaches. For preventing cerebral vascular dilation, we have beta blockers, calcium channel blockers, tricyclic antidepressants, as well as some anti-seizure medication. Anti-seizure medications have vasodilation control properties, such as topiramate and valproic acid. Tricyclic antidepressants prevents the reuptake of both serotonin and norepinephrine, and those two neurotransmitters are responsible for pain regulation. So, preventing the reuptake of serotonin also contributes to the vasoconstriction of the blood vessel. The increased level of norepinephrine in the brain helps dampen transmission of pain signal. So the migraine pharmacological therapy can be broken down into 3 mainstay of mechanisms of action: NSAIDs, which are non-steroidal anti-inflammatory drugs, triptans, as well as CGRP antagonists. So NSAIDs are usually the first line of therapy due to its cost as well as accessibility to getting access of use. By blocking the inflammatory mediators that cause the vasodilation of the cerebral blood vessels, NSAIDs can help alleviate the vasodilation and thus the interaction between cerebral blood vessels and the trigeminal nerve. This is useful at first onset of headache, but it may not be as potent since the inflammatory mediators have already caused the vasodilation of the cerebral blood vessels. The next class of medication are known as triptans. Triptans are structurally related to the neurotransmitter of 5-HT. and thus binding to the 5-HT receptor of the trigeminal nerve, which normally modulate the release of neuropeptides such as CGRP, prevents the release of the neuropeptides such as CGRP and substance P, which as a result prevents the cerebral vasodilation of the cerebral blood vessels. However, 5-HT receptors are not only expressed in the cerebrovascular, but as well as coronary and the digestive tract. And because triptans are not specific for the 5-HT specific receptors in the trigeminal nerve, they will also bind to the coronary blood vessel, which can cause vasoconstriction, and thus should be used in cautions in patients with cardiovascular disease. Finally, we have the CGRP antagonists, which are drugs that bind to the CGRP receptors. Remember from previously that CGRP is a neuropeptide responsible for causing vasodilation. The binding of these drugs to the CGRP receptor effectively inhibit vasodilation of the cerebrovascular vessels and ultimately may cause migraine attacks. Some of these drugs within this class of medication may also be indicated for abortive therapy or acute attacks, as well as prevention. Finally, the drug acronym component for the migraine treatment is far from Zen. These AAA batteries is kind of like a vital energy that makes you run. So this acronym summarizes the drugs for both the triptans as well as the CGRP antagonists, which includes specifically which medications are useful for prevention as well as for acute treatment. Far from Zen is a state of being when one has migraine. One is far from Zen. So F stands for furlotriptan, A stands for amitriptan, R stands for rizatriptan, Z stands for zomotriptan, E stands for alotriptan, and N stands for niratriptan. The AA is like an energy drink, much like a AA battery that provides you with vital energy to continue to run, since one is far from Zen. The 2A stands for Aimovig, Ajovy, V stands for Vyapti, E stands for Emgality. And the energy drink is used to maintain vital energy. And the run component is the acronym for the acute treatment of migraine, since a person can only run for an acute phase. So R stands for Rayval, U stands for Rybelvi, and N stands for Neurotech. Thank you for watching. If you found these videos to be helpful and enjoyable, please consider subscribing and hit that notification bell to stay tuned for future videos. Please comment below and let me know what other content you would like to see next. And as always, let's continue to empower a different way to envision success. And I'll see you on the next one.